Hello everyone. We have been recording certain cases related to obstetrics. Today is the third case of obstetrics, and this is a case study on hydatidiform mole, also known as molar pregnancy. So let's learn about this condition through a case. So we have a patient who is a 36-year-old woman who presents with vaginal bleeding at 8 weeks, 3 days gestation. She has never been pregnant before. Bright red spotting commenced 7 days ago, which she thought was normal in early pregnancy. However, since then, the bleeding is now almost as heavy as a period. There are no clots, and she has no abdominal pain. Systemically, she has felt nausea for 3 weeks and has vomited occasionally. And she has regular periods, bleeding for 5 days every 28 days. And her medical history involved a procedure called large loop excision of the transformation zone treatment after an abnormal smear 6 years ago. So, a large loop excision of the transformation zone is a medical procedure which involves the removal of abnormal cervical cells through a loop which has electric current, and it is used to destroy the abnormal cells present in the cervix. A transformation zone is an area in the cervix which has actively converting cells, that is, columnar cells, convert to squamous cells. That zone is known as transformation zone. And if there is any abnormal growth in this transformation zone, it is removed through a large loop excision. And this procedure is called a large loop excision of the transformation zone. This procedure is also performed using a needle, which does not have a loop. It is a straight needle. So that procedure would be known as the needle excision of the transformation zone. And after this abnormal smear 6 years ago, all her consecutive smears were normal. So on further examination, her heart rate and blood pressure are slightly low. Her abdomen is soft and non-tender. Speculum reveals a normal closed cervix with a small amount of fresh blood coming from the cervical canal. So cervix could be open or closed depending on the patients, but in early pregnancies especially, the cervix is usually closed. If it is open, it is known as an incompetent uterus, and it might result in a miscarriage. So the patient has a normal closed cervix, and there is small amount of fresh blood coming from the cervical canal, which was her complaint. Bimanually, the uterus feels bulky and soft, approximately 10 weeks in size, but the patient was 8 weeks and 3 days in gestation, so the uterus is slightly large. And there is no cervical excitation or adnexal tenderness. Cervical excitation is usually characteristic of any uh, uterine pathology, or it might be an indication of pelvic inflammatory disease, but it is absent in this patient. So, a urinary pregnancy test was performed to confirm her pregnancy, and it turned out to be positive. So, the patient is pregnant. And a transvaginal ultrasound scan of the uterus was performed, and a cluster of cells was seen which had a honeycomb-like pattern. So, the final diagnosis, by looking at the ultrasound scan, was made to be a hydatidiform mole, also known as a molar pregnancy. So the incidence of hydatidiform mole, which is also called gestational trophoblastic disease, this is a category used for any abnormal pregnancies that involve tumors. So hydatidiform mole falls under this category, and gestational trophoblastic neoplasia also is another example, which falls under this category. And the incidence of molar pregnancy is approximately 1 in 714. It generally presents with painless vaginal bleeding, though it may be diagnosed as an incidental finding when ultrasound is performed for another indication. So, the only symptom which is usually observed in molar pregnancy is a painless vaginal bleeding, as we can see in this patient also. And it is usually an incidental finding whenever ultrasound is performed for any other indication. Let's learn in detail about this condition. So, a molar pregnancy, which is also known as hydatidiform mole, it is an abnormal form of pregnancy in which a non-viable fertilized egg implants in the uterus. So, this zygote, which is implanted in the uterus, is non-viable since the start, and it is abnormal. It was never normal. And if it is always abnormal since the start, it is called as a complete hydatidiform mole. So there are two types, partial moles and complete moles. Partial moles involves part of the fetus cells and the remaining part is tumors. But in a complete hydatidiform mole, all of these cells are tumor cells and it does not involve the fetus cells at all. And as I mentioned earlier, it falls under the category of gestational trophoblastic diseases. And during a molar pregnancy, the uterus contains a growing mass characterized by swollen chorionic villi resembling clusters of grapes. As we can see in this image, this is called as molar pregnancy. So this is not a zygote. It is an abnormal cluster of cells that implants itself in the uterus and it starts growing uncontrollably. So even if it is a partial mole, which involves part of the fetus cells, or we might have a fetus along with the tumor cells, it would also lead to spontaneous abortion. So this condition always requires evacuation of the retained products, and it rarely results in a successful delivery. So it always results in a miscarriage or abortion. And chorionic villi are present in the placenta, which ensures increased contact of the fetus with maternal blood. So in this condition, the main characteristic feature is the swollen chorionic villi. These villi are swollen. These molar pregnancies are characterized into two types, which is partial moles and complete moles. And the term mole simply denotes a clump of tissue, just as it is shown in this image. Molar pregnancies usually present with painless vaginal bleeding in the fourth to fifth months of pregnancy. The cause of this condition is not completely understood. Potential risk factors may include defects in the egg, abnormalities within the uterus, or nutritional deficiencies. So, defects in the egg, uh, that means the egg might have an absent nucleus. So, sometimes in some patients, the egg does not have a nucleus, so it does not have the maternal chromosomes. And whenever the sperm fertilizes an egg with an absent nucleus, it reduplicates itself and forms a complete set of chromosome, but it is abnormal since it does not have the maternal chromosome. And these kind of cells form a molar pregnancy or a cluster of cells and implant themselves in the uterus, causing vaginal bleeding. Abnormalities within the uterus might involve any fibroid or tumor cells in the uterus, and nutritional deficiencies are also a risk factor in this condition. Women under 20 or over 40 years of age have a higher risk. So, women under 20 would have an underdeveloped reproductive organ, and over 40 have a high risk of molar pregnancy since they are very near to menopause. Other risk factors include diets low in protein, folic acid, and carotene. As we have seen earlier, one of the risk factor was nutritional deficiencies. So these are the diets which might result in this condition. If left untreated, a hydatidiform mole will almost always end as a spontaneous abortion. The diagnosis strongly suggested by ultrasound, but definitive diagnosis requires histopathological examination. So firstly, this diagnosis is confirmed by ultrasound. We can see a honeycomb-like pattern or a cluster of cells. But to confirm this diagnosis or to have a definitive diagnosis, we require a histopathological examination. And if it also suggests abnormal or tumor cells, we can confirm that the patient is suffering from a molar pregnancy. And on ultrasound, the mole resembles a bunch of grapes. Hydatidiform moles should be treated by evacuating the uterus by uterine suction or by surgical curettage as soon as possible after diagnosis in order to avoid the risks of choriocarcinoma. So there is a 2 to 4% risk of choriocarcinoma in molar pregnancies. So it should be treated by evacuating the uterus as soon as it is diagnosed. Patients are followed up until their serum HCG level has fallen to an undetectable level. So the serum HCG level is usually seen in pregnant women. So we have to ensure that it has fallen to an undetectable level. If the patient still has a detectable HCG level, it means that maybe the tumor cells have not completely been evacuated. Let's learn about the management and intervention of this condition. The management for suspected molar pregnancy is always evacuation of retained products of conception, also known as ERPC, with urgent histological examination of the tissue. These women should be advised first not to become pregnant again until 6 months after the HCG is normal. So, after the evacuation of retained products, we need to follow up the patient until the has reached an undetectable level. And once it reaches the undetectable level, the patient has to wait for another 6 months until she gets pregnant again. There is a 1 in 84 chance of a further molar pregnancy. So there is a high chance of another or like second molar pregnancy. They should have HCG monitoring after any subsequent pregnancy, whether live birth, fetal loss, or termination. So after the removal of this molar pregnancy, any subsequent pregnancy should have a follow-up of HCG or the HCG should be monitored in the patient. The combined oral contraceptive pill may safely be used once HCG has returned to normal. So once the HCG has returned to normal, after that, the patient can safely use combined oral contraceptive pill. Till then, any hormonal treatment should be avoided. So that's it for today's session. Thank you for watching and please share this video. Thank you.